What we wanted to do today was to bring our hospital partners. We are all in this together. It takes governmental agencies like the health department, as well as our healthcare systems and many others to make sure that we get through this pandemic. So I'm going to turn it over to Dr. Keith Norman, who's going to speak a little bit from the healthcare perspective, and then we'll have other healthcare leaders join us.
Thank you, Dr. Haushalter. On behalf of Baptist Memorial Healthcare and the 19,000 employees who have worked tirelessly to fight this pandemic since day one, we come to reaffirm our commitment along with the other major healthcare partners here in our community. With over 22 hospitals in this region and 12 in the Memphis, Arkansas, and Mississippi border area, we realize that this virus is spreading in communities near our city and county. We're encouraging all of those partners in those communities, our friends, our families, our loved ones, to please follow the protocol of the health department in your area. And if there is no protocol, if there is no mandate, create your own. Wear a mask and keep social distancing as a part of your daily practices. We've conducted over 300,000 coronavirus tests here in this community, and we're not tired. We're ready to win this fight. We realize that by working with government, working with the Shelby County Health Department, our mayors, and each other, we can tamp down and stamp out this virus. We encourage you to please follow those protocols and to work hard and tirelessly. Finally, if I may change hats for a moment, I also speak with the faith community. There is a very familiar scripture that says, "Do not let us lose heart in this season. For in due time we will win if we don't grow weary." We acknowledge that COVID fatigue is real. Seasonal affective disorder, sadness comes at this time of year. But we would like to affirm and acknowledge that it's not just impacting you, it impacts all of us. But we recognize that it is necessary to remain vigilant. When we consider the alternatives and the possibilities of long-term illness, or even worse, the loss of life, it is far more important that we remain vigilant and fight together. Let me encourage each and every one of you to remain vigilant, to remain committed, and let's win this battle together. We're working together, we're fighting together, we will win together. I'd like to now invite my colleague, Dr. Cassandra Howard, to the podium to share her thoughts.
Good afternoon. I'm Dr. Cassandra Howard, Vice President, Chief Medical Officer for Methodist Bonheur Germantown Hospital. I'm here on behalf of my system, Methodist Bonheur Healthcare. The trends of the new COVID cases we're seeing now are definitely cause for concern, but we're prepared if cases continue to climb. Towards the beginning of October, Methodist Bonheur Healthcare had its lowest number of COVID inpatients since the peak that we saw in the summer. We were at 57 inpatients at the beginning of October. In less than a month, the number of patients has more than doubled. As of this morning, Methodist Bonheur Healthcare has 121 COVID inpatients across the system. We have capacity to meet the needs of the community now. We also have surge plans in place at each of our hospitals. A benefit of being a part of a large hospital healthcare system is that we can move patients from one hospital to another if needed to ensure they get the best care possible. We have had significant successes with staff recruitment and continue to aggressively recruit additional staff members. We are in a critical moment right now with this pandemic. While we all may be suffering from pandemic fatigue, we can't lose focus. I can't emphasize that enough. We can't lose focus. We must continue to wear our mask anytime we're in public and around people who do not live in our immediate household. That is in addition to socially distancing and staying 6 feet apart, washing your hands frequently, and disinfecting surfaces, public surfaces that are touched frequently. Equally as important, please stay home if you're not feeling well. My closing sentiment to you is please partner with us and do your part outside of the hospital and we have you covered inside of the hospital. Next, I'd like to introduce my partner in crime, Dr. Martin Croce, the Chief Medical Officer at Regional One Health.
Thank you, Dr. Howard. See, it's very easy to just wash your hands as soon as you encounter past a container. On behalf of Regional One Health, I do want to thank the city and the county and everyone involved with this, our hospital partners as well. I would just like to reemphasize a few things. There's really only 3 things that we can do to combat this virus. One is wear your mask. It's really quite simple. We wear a mask. I'm a surgeon initially before I entered this role, and frankly, wearing a mask is just not that big of a deal. You just wear it, and that not only protects you, but it protects others as well. It is not a sign of weakness. It is a sign of actually caring for our fellow Memphians, our fellow Shelby Countyans, our fellow Mid-Southerners, our fellow Americans, for goodness sakes. So wear our mask. Wash hands. Again, quite simple. Whenever you pass a dispenser, just reach over, flip it, and wash your hands. Very simple thing, but very effective at combating this virus. And finally, stay apart from each other. With the holidays coming up, it's going to be very difficult. As mentioned earlier, it's nice to get that hug from the long-lost aunt. But we can't do that. We just can't do that this year. And in order that we can do that next year, we have to act now so that we can get ahead of this thing and stamp out this disease. Only by working together with all the hospital partners, with the city and county government, with our neighbors, and with our friends, we can come out ahead. Finally, I just want to mention one thing, that frequently we all have our antennas up when we're at work, because there are people around and they'll say, hey, put your mask on, or don't forget to wash your hands. But sometimes we let our guard down when we leave our place of employment or wherever it is we happen to be. That's where this thing is. It's like, just imagine there's a bear behind every corner, and it will sneak up and get you. So please, we must stay vigilant the entire time that we're awake. I'd like to now introduce Jennifer Chiusano, who's the Chief Nursing Officer at St. Francis. Oh, one other thing. This is not wearing a mask. This is wearing a mask.
Thank you. Well, good afternoon. I'm Jennifer Chiusano. I'm the Chief Nursing Officer at St. Francis Hospital in Memphis, and representing St. Francis Hospital Memphis and St. Francis Hospital Bartlett. Please, I'm not going to go over everything that's been gone over so well by my colleagues here. Thank you to the health department, Doug, everyone here. They're doing an amazing job, by the way, this team. I do want to comment that the teams are working so well together, these health systems. Thank you. It's an honor. Wearing your mask, I can't emphasize enough, it's not political, folks. Please, I'm begging you, I'm imploring you, wear your mask. Social distancing is incredibly important. Even if you're in conference rooms, break rooms, you need to be spread out when you have meetings and things like that. It is still out there. We're all happy to take care of patients. We want to take care of patients. It is heartbreaking to see patients die from COVID. I've experienced that. I've experienced colleagues die. Please, I beg you, wear your mask, social distance, and remember, go to the health department websites. They're here to help you. We appreciate you, and stay safe. Thank you.